have set up, right? So 2 60 cc syringes. Most places for an adult, you're going to inject 2 bottles or 2 50 cc's in each syringe of contrast. So you need to have that. You need to have your contrast tape. Have, you know, maybe 2 or 3 pieces ready off to the side here just for the injection part. You need alcohol, a needle. We're going to use a butterfly, not the Angiocast, because this is just real quick. Okay, so we're going to use this one. Tourniquet, some sort of something to put on when you take the needle out, right? So I am not a Band-Aid person. I don't like those. I think they hurt worse than the needle part. So most places you can just find a cotton ball, a piece of tape, or the Cobands that they're using now. That's less irritating. So for our purposes, we're just going to use a 4x4, but we're not going to actually tape it down. And a needle to draw the contrast. And we have our alcohol for the patient, and we have alcohol to draw the contrast. So in Ms. Garb's class, did you practice this part? Mm-hmm. Okay.
Did you mean shooting water guns at each other with saline?
Right. Oh. All right, so real quickly, so this should be a review then. You're going to draw with a large, just straight needle. Okay, so what's larger, 18 or 23?
18.
18, right. You need, you know, because you're pulling the contrast back, you need something that with a large hole or a bore. So I'm just going to put on. Okay, you get your contrast ready. If you have 2 bottles, some places have the contrast already in the syringes. You don't have to draw, that's always nice. You open clean the top. Okay, you take the needle off or the cap off. Okay, now so this is how I do it. I'm not sure how, you know, she went over it with you guys. You need to have about 10 to 20 cc's of air in your syringe, because otherwise you don't have anything to put into the bottle for a vacuum. Okay, so I put about 10, 15, and then I use my little finger to anchor this. You don't want to be kind of out like that. Okay, so I use my little finger to anchor it and then just draw it towards, okay, upside down. Then you inject a small amount of the air, and it should just counterflow really nicely right back in. If you don't, like I was saying, then you're trying to pull against the pressure that's already in here. Okay, so then you would take it out.
So do you want to draw that up before the patient comes into the room?
Yes.
Okay, because you whip out that.
Yeah, you see this, and the patient's not going to go well.
Okay.
And most of the time, the contrast has been in a warmer, because like I was saying earlier, it's real viscous. So it needs to, you know, the warmer it is, the less viscosity, it goes in more quickly. And if you don't use it, you know, well, in the old days, if you don't use it, you knew you were going to use it tomorrow. You just date it, put it back in the warmer, but I'm not sure how they handle it now. All right, so never recap a needle. I get that, but that's kind of the real world versus the non-real world. So that syringe is ready to go, and you can just take this syringe and put it on here and do the same thing on the other side. Okay, so when you inject, or when you're getting ready to inject the actual patient, you can either have this, you know, as is, so this is filled with contrast. You can either have it, you know, just off to the side waiting, and then you let the blood flow back into it, or you can have this already primed. So if you have contrast in here, you would just run it out towards the end of the needle. You just can't inject a whole line of air. Okay, so however you do it, you have to make sure that you're not injecting air into the patient. All right, so we're going to leave it like this. It's ready to go. So now my tray is ready. I have all my time markers ready, so you want that out as well. So we need I don't know why we have this. All right, you need your right and left. Okay, so a word about markers in here. You cannot put markers with this contra tape in this table. Okay, I know you guys learned to tape your markers backwards. It gets thick. This table is really thin. I don't even know how many student markers we have in this table. You cannot put a thick set in there. Okay, so you can either use these. If you use yours, you can't put it on the patient because that doesn't work. I don't want you putting it on the table, so I would just take some of the tape off. I think it's kind of a little overkill to have that much tape on it, but okay, so we're just gonna go here. All right, so what we need right and left. You're going to need a pre or a scout, whichever your facility has, but you have to have some way to mark that that's the image prior to the contrast. So we're just going to use this little scout guy here. Okay. I don't like all this tape. Sorry. I use one piece of tape and then just take the marker off, save that piece of tape to anchor it down. It's not in there that long, so you don't need to like tape them all up. So there's a 1 for the immediate, for the 1 minute. Okay, I have a 5, a 1 and a 5 here. Okay, so here's my 5 minutes. So I have 1 minute, 5 minute, 10 minute, scout. For 15, you need to put the 1 and the 5 together. Okay, and just tape that piece down. Then you have the 25 taped together already because it's going to go chrome like this. Okay, you're going to flip it. Left, right, and then you need a post or an after. Okay. Good grief. Look at all that. That's crazy. All right, so tray's ready. So I'll check your tray. So Sarah, you're the patient, right? Okay. All right, so I'm the tech. So I'm going to do the standard, you know, what's name, date of birth.
Sarah P. Sybil's 10/19/92.
Okay. First day of your last menstrual cycle? 3 days ago.
3 days ago.
Thank you. Did we talk about it?
Yeah. Extensively.
She doesn't like it sometimes.
I just sit in the back and
She's on drill.
All right, so the next thing I would say is my name is Shelly. We're going to do an IVP. What kind of problems do you have in or what brought you in today?
I'm having kidney pain.
Okay, which side?
Left side.
Left side. Okay, so kind of show me where you're pain.
It's like right here.
Okay. And how long have you had this?
Like a week.
Okay. And so that's pretty much, you know, for us. There's some other questions that you could ask, but we'll just stop there. All right, so the next thing I'm going to ask is, well, I'll tell you what kind of exam we're going to have. We're going to do an IVP. It's a study of your kidneys. We're going to inject some contrast into your veins, take some images about every 5 or 6 minutes. The whole thing lasts about 30 minutes, but I need to make sure that you've taken your prep. Yes. And then you would ask some follow-up questions. Did it work? All that kind of stuff. And then I would say, I need to make sure that you don't have any allergies. So, are you allergic to
Shellfish.
well, you can say shellfish, but shellfish is just an indication that somebody has allergies. It's a predisposition to allergies. Okay, it's not necessarily the iodine. It's just if somebody's allergic to everything, then they have a predisposition to being allergic to things. So those are really some of the questions that you would ask. So what kind of allergies do you have? If they say shellfish, then you have to stop and then kind of check out. But I have consent that I need you to read and sign, check anything that applies, and if you have any questions, let me know. So that's it. All right, I'm gonna have you put this gown on and I'll give you the gown. I need you to take off your pants and your bra. You can leave your shirt and your underwear and your socks on. When you're done, come back out. You don't take it. Okay, so she's done all that. All right, so the first one I'm gonna have you do is just a picture before we do anything. So I want you to lay on your back. We're going to use a 14 and a 10. So what I've written on the board here is just essentially the whole process. The things that are in purple are like stop and check moments. Okay, those are the things that you need to stop. Make sure you've changed whatever it is or it's different. Okay, so we're going to start with a 14 by 17. It's nice that this is, oh, there's one in there. I'll hang it. This exam, all at 40 inches, when we get over into the other stuff, the upper GI and the lower GI, we have to start changing. We're moving our tube around. But for this one, you can pretty much set it and leave it. With the exception of detents, you have to make sure that you're in detents. Because if you're not, and you're doing 6 images or 6 or 7 pictures, you're out for one. It's, you know, each projection. So check that. Unfortunately. All right, so what am I going to put on here, marker-wise?
Scout.
Scout and?
Right.
Right.
I was just answering.
This has got so much tape on it, it's just gonna stick. Right. And Scout. So this is a Scout AB. Gonna be at 40 inches. I'm gonna center. I really shouldn't have to center any long, once this is lined up, then I don't need to touch this or this for the rest of this exam because we're not going anywhere with it. We're not angling, we're not doing any of that stuff. All right, so there's my center, right, Scout. I'm in D10s, I'm at 40 inches. I need to make sure that I'm at my 14 by 17, which I am. Next thing I'm gonna do is make sure that she's straight on the table. So I need to bring your shoulders over just this, a little bit this direction. Now, where's the centering for KUB?
Iliac crest.
Iliac crest and then the mid-sagittal plane, right? So, I'm gonna feel for your hip. Here's the bony part, and we were talking about this the other day. Here's the bony part, but her top of her hip is actually up here. Okay, so you need to make sure that you're going to the right spot. Sarah's probably too long. We would have to do bladder shots on her as well for every position. Every time, if you can't get everything on there, all of your shots would have to be 2. Okay, you would have to do a high, which would be the kidneys and ureters, and then you go down and do a bladder shot. We'll talk about the bladder stuff on Monday. And then mid-sagittal plane. Here's her hip. On females, or anybody really, you can either just feel for their ribs right here, or you can just go right to the center of their sternum, the bottom, okay, and that'll tell you. I don't do belly buttons. Belly buttons move on people, especially when they're laying down, so I don't think that that's a
Might be
good.
way up here.
Well, I mean, move as far as, they're mobile. So, all right. So, I would just set right here. Okay. So there's her scalp. What is the breathing? Expiration. So I'm going to come back here and I'm going to set just a regular abdomen back on my console. And then I would tell her, I need you to take in a breath and blow it out. Don't breathe. Prep expose. Okay, so there's my scalp. All right. I'm going to go ahead and set up for my, I would take this and show this to the radiologist. Now I'm going to go ahead and set up for the immediate, the nephrogram. So leave my right marker here. I need a 10 by 12. Where was the centering for that? Do you remember?
Halfway between
Okay, so since I'm using a small film, you kind of have to pile these really close to the edge. You don't want to migrate, have your markers out in the kidney. So we want to keep these as close to the edge as possible. What else am I going to use?
1 minute.
1 minute.
What do you mean 1 minute?
This is going to be immediately after you inject. So if you have an immediate, or if you're post-processing, you would put immediate or 30 seconds or whatever you're doing.
Oh,
But
you like pretended to already inject me.
no, I'm setting this up.
Oh, you're setting it. I'm sorry.
Because it's going to take me longer to inject. I need to get this all set and ready so I can just run back there when I'm done injecting.
Okay. I don't know why I interrupted you. Sorry.
All right, so I need to change to, I always do it backwards. Okay, so I've changed my collimation. I'm 10 by 12, right, 1 minute, and everything else is centered and should stay the same. So I don't need to touch this or this anymore. Okay. All right, so I'm going to center halfway between my iliac crest and xiphoid, so you can do it this direction and kind of just kind of eyeball it. So there's her crest, there's her xiphoid, so she's right here. Okay. Now, I'm not going to go prep expose, now I need to inject. Okay, now I'm just ready, so as soon as I'm done, I can go back there. Okay, so we need gloves too, but we're not going to wear them for the injection, but let's put them out here so we have them. You don't want to forget, just to. Okay, so you guys remember tourniqueting? Okay. Got to make sure to get it tight, huh?
That was the hardest part.
It is. It's hard to get it tight enough. All right. So I'm going to go ahead and inject. So relax. Okay. So cross. This is how I do it. I'm assuming this is how you were taught. You cross, pull the right up high, pinch, and tuck. Okay? Everybody come through this for me. Okay, so come look. You need to come check out which one we're doing. All right, so this one is really nice and pretty. Okay, it's puffed up. It's going kind of at an angle, and there's a valve right here. This is deeper, but it's larger. And we're going to power inject, so we want to have something that's bigger. So if this pops up and now I can really feel it, I'm going to go here. Okay, even though this one looks nice and pretty, this is kind of a backup turnout, and there's
So
usually
for
one right here.
Our checkoff, we're going to actually pick a vein.
You're going to pick a vein. I'm sorry, I'm going to talk about that.
Sorry, too. Good luck.
Yeah, no, we'll just kind of play. I know it's getting tight. There's one right here. So can you handle this for a second? Okay. So come feel these. Okay, so this is the one that we're probably going to use right there, and you can feel it. Okay, you can come out here and feel this one. And then this one is big, but again, there's a valve right there, so you want to make sure that you don't blow anything. Okay.
Slap it a couple times. You don't.
Okay, so I don't want her to like lose circulation. So then you would open your alcohol. Okay, you're going to clean. So we're going to go right here. Then you have your syringe. I'm already attached. You're going to use bevel up if you're using a butterfly. Syringe. Okay, and you're going to tell them, just kind of set this right here. You're going to feel a little bit of a prick. I would have gloves on, obviously. That's one in that direction. At about a 20 to 40 degree angle. Insert. You see the flash. Okay. You either have your tape here or on your box, whichever, on your collimator box. And just kind of lightly tape it down. Okay, we don't need to get carried away. Pop the tourniquet. If you push that against the tourniquet, you'll blow the vein. Okay, because there's no place for it to go. There's some pressure. All right. So you're going to tell them, I'm going to inject. You're going to feel a warm sensation, maybe a funny taste. Anything else, let me know. It's just air pushing against you. Right. And that's it. Okay, so let me show you how to change out. So I have this one on. You're going to, if you're using a butterfly, if you're using a Heplock, you're going to have the big 18 gauge needle on there. Okay, and you're still going to have to switch your needles out. But so you're going to pinch and turn it, keeping this pinched. And then put the other one on, and then you can open it up. Okay, and then inject, inject, inject. Now, if you're using a needle or a butterfly that you're going to leave in their arm for 5 minutes, you need to tell them that you're leaving the needle in. So what I do is I say, I want you to hold this right here, and so that you don't forget that you have a needle in your arm. Okay, so I just kind of have them laid out to the side. Okay, that's done. I kind of do this little cleanup real quick, but I only have a minute. So, okay, we're injected. So now I run back. You can check. Don't move anything. If they haven't gone anywhere, you should be good. All right, taking a breath, blow it out. Don't breathe, prep, expose. Okay, so there's my 1 minute. Now I'm going to go back to the 5 minutes. So I need, all right. Right. 5. Open the collimators back. I think I've got that up there. Yeah. Go back to this position because this one should stay the same. Okay, I'm set. I'm going to walk back out. All right, and you take in a breath. Blow it out. Don't breathe. Prep, expose. All right, you can breathe. At this point, I would have time to take the needle out. Okay, I've got like a 5 minute lag in there. So then I'm going to go ahead and take it out. All right, I'm going to take this out. You're just going to have your 4x4 if you were using a cotton or whatever. Just going to take the tape off. Sorry. This is wicked tape too. I think this Garth bought this last year. Okay. Just going to put this over the top. You pull out, press down, and then you have them bend their arm until they're done. Take that. All right, so next on our list is what? 10 minutes. Right?
Sorry.
this all stays the same. All you're doing is changing your time marker out. You're going to do a KUB. So 10. Make sure she hasn't moved. Okay, that's fine. All right, take in a breath, blow it out, don't breathe, prep, expose. All right, now I'm going to do my obliques. The only thing I change on my film is just my time marker. I'm not going to make you physically change the films and take them back and come back in because that just takes up time. Okay. I'm assuming at this point you're past the point of forgetting to do that. Why? Are we not? Do we need
Oh,
to?
no, we're back.
No, we're good. We're
We
good.
got it covered.
Actually, I double exposed the other
Well, don't tell me that. I'm going to make you have to do that then.
Sarah, shut your mouth.
Just kidding.
Well, with digital, we all have to change that.
Yeah.
All right, obliques.
We really do.
So I've changed my marker. Now I'm going to do my obliques. I do RPO, LPO, and then I have them keep going so that they're kind of going in a circle. Okay. So what I'm going to do is I want you to bend this knee and bring your right or your left arm across your chest, and you're going to roll up towards me. You can, if you have a 30 sponge, most places don't. They usually have a 45. You can use it. That's nice, but okay. Come up. And then roll back. Keep this arm up and keep this knee slightly bent. All right. So she's at about 30-ish. Right, let me show you what 45 looks like. Lean up. Up. On one motion. Okay. That's 45. Okay, so there's pretty significant difference. If you don't have the sponge that's got the nice sides like this, you put them at 45 and then kind of jerk it out from behind them. You know, just a little bit, just enough to get them back. And you can eyeball it. You'll know what 30 degrees is. Okay, so we'll just leave it there. You're going to leave that arm up. So where's our center for this?
2 inches.
2 ways. It's the center is on your iliac crest. It's either 2 inches lateral to the upside mid-sagittal plane, or you can do 2 inches medial to the ASIS. Most people, that's the same. Okay. Did we decide? Did you guys measure your fingers? You need to know where 2 inches is. Okay, so you need to measure at some point. This is mine. All right. So this one shoulder up. So this plane should stay the same. Here's her ASIS.
Yeah.
Right here. There's her mid-sagittal plane, so it's about the same. Okay.
Measuring. You're about to say. I measured
All right.
out my scarves.
I want you to come hither. Come hither. Right. In this class, from this point, the first checkoffs I'm not going to take off if we don't manage the light. From this point forward, I will. Because the point is to go to where Meryl says to start with. But if it's not going to work, then you have to change it. You don't have do-overs because you have contrast. And I get that. Okay, so you have to start at the 2 inches. Then you need to stop and look at what your light's showing you. If you have a patient that you've got, and it's hard on Sarah because she's fits really nicely. She's got light on both sides. But if you have this look here, where you have lots of light on the table and it's cutting through the patient, then move it over. Okay, you don't want to err just because that was where the center is supposed to be. Okay, and that's a little bit more on just like an average. Like on me, you know, you would have to stop and look. And okay, if the light field is going here, but I have some light over here, then stop and, you know, you're not getting anything out there. So then stop and move the light over to where you know that you're going to have both kidneys. So the very last thing that you should do after you've positioned and you're kind of where you think you need to be is stop and say, do I have the kidneys on there? You've seen them already a couple times on your other images. You know if they're close, if they're fat, if they're wide. You have to stop and say, do I have it? Because you don't get the do-over that you would get for like a normal repeat kind of thing. Okay. All right, so there's that one. So that's what I'll tell you. And then when I do checkoffs, I stop you in between your precision, you know, procedures or positions, and we fix whatever it is. Okay, so that's different, I think, from how Ms. Wagner does it. Okay, lean up. We're going to do the same thing in the other direction. So you're going to roll away from me. This arm comes up. Now, not too far up. You're too far up on this. Okay, bring this arm up. Okay, straighten out just a slight bit. See, with her knee so bent, it twists the bottom, her hips. Okay, with her arm, bring your arm back by your side. If her arm is back here, it kind of does the same thing. It twists the top. Okay, so that's what you're going to do at the very. You're going to make sure that all of this stays in a line. I want you to straighten this out just a slight bit, and she's laying on her hip. Scooch back. There you go. Okay. So now you want to make sure that this plane is straight. Okay. So theoretically, we should be pretty close to the same spot here. And then there's her ASIS. It's going to go right here. And then I'm going to stop and say, okay, well, I have this side of her, and I've got a lot of light on the table here. You might center just a little bit, okay, just to make sure that you don't have her so far off. She's thin, so that makes it really easy. But again, you know, most people, they're going to take up the whole light. Okay. Now, if you have somebody that is average, and you have a lot of light on the table, and you're needing to move them more than what you think, you've got them turned up too much. Okay, they're too obliqued. So if you turn up some more, go up into your 45 degree. Okay, right there. And if I go where I think I'm supposed to, this 2 inches, I've got like 4 inches of light over here on the table. Okay, so as the person turns up, they get skinnier and you have more light. So that's the first thing to check their rotation. Okay, and then start adjusting your light. Okay. All right, so I would go to my position here and I would say, okay. All right, I'm just taking a breath, blow it out, don't breathe, prep, expose. All right, so the next one we're going to do is a PA. Really important to change to the left marker, and you're going to use the 25 together, but you have to flip them, otherwise it's 52. So left marker, 25, flipped. Left marker is flipped. That's a pet peeve of mine. If you're doing a PA, you need to turn your markers so that it's correct. Okay. I'm just going to have the patient. I want you to roll all the way over onto your stomach for me. You're going to put your hands up and then under your chin. There you go. Under your chin.
Oh, sorry.
Hands up under your chin.
Right here?
Yes.
Okay.
If they're turned, it's the same thing. Okay, you don't want them crooking, and they're not there that long, so you just have them do this, or have them hold the pillow like this. But when they start to get comfortable, then they start to twist, because that's not comfortable. So other than that, it's easy. You're going to go back to your iliac crest and the spine. You can't get more mid-sagittal than that, so you just put your hand right over the spine, and you're good there. All right. Take in a breath, blow it out, don't breathe, prep, expose. All right, I'm finished. I need to go show these to the radiologist. You can lay however is comfortable. So I take this out, I go show the radiologist. All right, she said everything was great, so I'm going to let you go ahead. I need you to get up and use the restroom, empty your bladder, and come back in, and we'll take one more. Most places do an upright post-void. Okay, so you need to check that and make sure that before you put them back on the table. We're just going to do it on the table. Okay. All right, I want you to roll back over for me. She would have been up and then back on. So the only thing I need different here, I need to make sure that I change my right marker back. And then I'm going to use post. And this is just a KUB. Again, so lots of KUBs just rolling around.
Our old patients always get really upset when they have to keep rolling.
I know.
You haven't mastered KTB, you will now.
You haven't what?
You haven't mastered KTB,
I know, right?
you will now.
Okay.
I hadn't mastered those.
Iliac crest, mid-sagittal plane. Taking a breath, blow it out. Don't breathe, prep, expose. All right, you're all finished. I'm gonna let you get up and change. Your doctor should have the results in probably 3 to 4 days. That's it.
All right, so if you got a really big patient, and you would usually do a top and a bottom KB, you just do the top and bottom?
Every time you have to go back and forth. And that's what I was telling the other ones. If you have that happen, you're centering all of those, you have to do a high and a low. So I would mark the patient like with a Sharpie or something, just a dot. So
Just like
that's recorded.
where it's going to be.